patient is a 74-year-old white female who presents the office today for evaluation of her right parotid period. The patient reports that in 1997 she had surgery involving her right parotid for a mixed tumor period. She states that for about the first 6 months she had a lot of problems with dripping of her face with eating period. This problem has improved, but she still occasionally gets sweating over the right cheek with eating period. She also reports that typically about twice a year she gets swelling over the right side of the face with eating period. In fact, about a week ago, she developed acute swelling of the right side of her cheek with eating, and this was associated with a flushing/diaphoretic feeling and a feeling of heart palpitations. This has reoccurred multiple times in the past 5 days, with the last episode occurring yesterday. She was concerned this could be an allergic reaction or some sort of parasympathetic generalized reaction. She's been very anxious about eating certain foods. In fact, she states she had a recent cardiac workup which was negative. Physical examination is a well-developed white female who's awake and alert. Face is face-symmetric facial cognitive deficit. Neck reveals scarring within the right neck from prior parotid surgery with mild tenderness over the residual parotid tissue palpated on the right without a discrete mass. Oral cavity shows linear scarring of the buccal mucosa bilaterally. When palpating on the right parotid, I did see a little bit of cloudy-looking salivary drainage from the parotid duct, which was cultured. Oropharynx is Malpotty class 2 without concerning mucosal lesions. So the first diagnosis is neoplasm uncertain behavior of parotid. The patient is a 74-year-old white female who underwent parotidectomy in 1997 for a benign tumor, which was likely a pleomorphic adenoma. She has had some issues with Fry syndrome and has reported swelling and tenderness over the right parotid for the past week associated with some systemic symptoms. I'm not sure of the etiology of the systemic symptoms. I suggested that we treat the patient as if there may be a parotitis and get imaging of the parotid gland. Under styloadenitis, they see above. Because their patient has been reporting intermittent salty-like drainage from the right parotid duct, and because I saw some thicker, clear saliva with palpation of the parotid gland cava, cultures were obtained, and I'm going to suggest that we use antibiotics while waiting the results of the CAT scan. She has recently been prescribed Augmentin by a GI doctor, which would typically cover for most bugs that grow from a salivary styloadenitis. She will start this medication, and we will call her with the results of culture when available. Under dehydration, the patient reports she only has one kidney. I explained if we were going to adequately image the parotid, this should be done with contrast. She would like to check with her nephrologist. We will also check a BUN and creatinine before the procedure. If these tests are normal, we should be able to safely proceed with imaging with contrast. Under Fry syndrome, the patient, or auriculotemporal syndrome, the patient has had history of Fry syndrome since the surgery. She's concerned that the episodes this past week could be related to some sort of parasympathetic centralized reaction. I'm not aware of that being a problem after parotid surgery. If the CAT scan doesn't show any abnormalities, I will likely discuss her case with a head and neck cancer specialist to see if they have other suggestions on treatment if this problem recurs. In the interim, she's encouraged to consider trying an antiperspirant over the right cheek if she is bothered by the sweating symptoms with eating.